Researchers say babies between 1 to 12 months old should sleep at their backs instead of their stomachs. This, according to scientists, reduces the risk of sudden infant death or SIDS. A pediatrician at Sompa Clinic, Dr. Yvonne Brew, told GBC24 that the sudden infant death syndrome is much higher when a baby sleeps on its side or stomach.
Sudden infant death syndrome, also known as SIDS, occurs when an infant 1 to 12 months old or younger dies during sleep without warning signs or a clear reason. SIDS is one of the leading causes of death among infants and claims the lives of over 3,000 infants worldwide annually. It is a frightening prospect because it strikes without warning, usually in seemingly healthy babies. SIDS remains unpredictable despite years of research. Although there is no 100% way to prevent SIDS, there is a lot one can do to lower a baby's risk. Scientists outline that one can reduce SIDS in babies if infants should sleep in the same room with a parent for the first year of life, or at least for the first 6 months.
It's been found that these healthy babies who die suddenly in their sleep do have a little underdevelopment in some parts of the brain. In such babies, when they sleep and they feel that they cannot breathe because maybe their nose is covered or there's a cloth on their face, what every person should do is to immediately wake up and start breathing. But for such babies, the alert does not come from the brain, that they should move their heads. And it is thought that that contributes to the death of such babies. So the recommendation is we do not want to clutter the bed with woolen shawls and woolen blankets. There should just be a cot sheet on the bed. The baby should lie on the cot sheet, and then we should not cover the baby with too many clothes. In addition, we want to avoid as much bed sharing as possible. The baby should have the freedom to sleep and roll around comfortably.
Researchers say a baby's risk of SIDS has been found to be 1.7 to 12.9 times higher if he sleeps on his tummy instead of his back. When a baby sleeps tummy down, he is more likely to overheat, have pauses in breathing, and re-breathe the air he has just exhaled, which lacks oxygen.
When you want to put a baby down, make sure that the bed is firm with just a cloth on the bed. And then you put the baby on the back this way to sleep. Okay? And if you want to cover the baby, you cover the baby with a cot sheet. So such a baby will not have anything covering their face. You can easily see what is happening with the baby. We do not encourage woolen sheets for the babies, because these ones, the baby can easily pull it to cover the nose. So the baby, do not use this to cover a sleeping baby. Just use the cot sheet to cover a sleeping baby. Put the baby on the back and the baby will be just fine.
Doctors advise that parents should insist that caregivers or whoever is in charge of monitoring their babies must put them in a correct position.